And with Obamacare now breathing down everyone's necks, do you see a lot of physicians as well and surgeons wanting to adopt some kind of model like this?
Yes, in primary care, the movement of physicians away from the government payers, away from the big carriers, that has gone viral. One form of it is concierge medicine, but even if you take concierge medicine out of the mix, more and more physicians are just telling their patients, here's what I charge for an office visit, and it's very reasonable. And if you've got insurance, I'm gonna just let you deal with them because it's costing me too much money and hassles to do that. So in the primary care world, this is a huge movement that is growing every day. What we hope to do was show that at the facility level, where we're doing complicated surgeries, that we could also be upfront with pricing and be honest and deal on this basis with patients. We wanted to show that those who would say it can't be done were wrong or maybe duplicitous and benefited from the current system and wanted no part of it. But yes, this is a huge movement that ultimately will be satisfying the demand and need of this new and growing consumer marketplace. And it will be very deflationary. It will promote competition. It will promote higher quality. And all of those things will happen in spite of the government, not because of any of their attempts.
Now, but when it gets to government, that's part of the thing that's a big part of the picture why the healthcare picture is so dysfunctional right now. What could be done at state levels in most cases to remove some of those impediments? What are the things that are most responsible for distorting our government, our medical price system?
There's no question that the vast majority of blood is on the hands of the federal government to the extent that they have tinkered with this system for the benefit of their crony pals. The state governments have gotten in on the action as well, by enacting, for instance, certificate of need laws. So let's say you want to open a surgery center that would emulate the surgery center of Oklahoma and you live in the state of Georgia. Well, then you run into this commission, these guys who are hospital administrators who don't want you to compete with them.
These are competitors.
They don't want you, they don't want you to open, and they get to decide whether you get to open. Well, there's no mystery about why that certificate of need process exists, and there's also no mystery about how it came about. So any attempt by the government to, at any level, state or federal, to thwart the coming into the market of upstart, of new players, that is completely designed, regardless of what is said, that is completely designed to hamper competition and keep competition at bay so that the current really unsustainable mess continues. But certificate of need laws stick out as the most obvious move that states could make and just completely get rid of those.
And there's over 30 states that have that.
I think my last count was there are 37 states that have those. And some states have it in some sectors and not in others. They may say we can't have any more lithotripsy machines unless you go through the commission, or they may say we can't have any more surgery centers, or we can't have any more hospitals or MRI machines. And so sometimes they're selective. Some states are not selective at all because the grip of the big health corporate syndicate is so tight that some states the certificate of need applies to just about everything.
And as an advocate of an ardent free marketer, it must be very aggravating to you to have people blame all of this on the free market. They say, yeah, those big corporations, it's the free market at work here, and you know that isn't the case.
No, and again, that's part of the reason we put our prices online. We're all the greedy doctors who want to own and control our own facility, but that all holy water when you realize our prices are a tenth of what the not-for-profit hospital across town that supposedly isn't greedy is charging patients. This is not a failure of the free market, it's an absence. If you want to see the market at work in healthcare, you look no further than LASIK surgery or plastic surgery, where the prices are falling and the quality is going up, and that's the way every other industry works. So yeah, that was part of what we had in mind when we put our prices online, was to show that no, this is the free market, and when you embrace the free market, you have the chance of this wonderful value proposition where the quality's high and the prices are low.